بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is presenting a case of horseshoe kidney. One with incidental finding with no symptom and the other one after trauma. Here, as we see in this axial T1 weighted imaging MRI with fat set, there is a fusion between the both kidneys at the midline below the level of the inferior mesenteric artery in that area, and both kidneys are mal-rotated as we see here. Horseshoe kidney is the most common type of renal effusion anomaly, and it is more susceptible to trauma and also increased risk of development of renal calculi and increased risk of developing of transitional tumor in the renal pelvis. Also, there is increased incidence of Wilms tumor and renal carcinoid, and also it is increased the incidence of the renovascular hypertension. Also increase incidence to hydronephrosis and pelvic junction obstruction, with increased incidence to infection and pilourethritis cystica. Here, this is the patient with horseshoe kidney, and the effusion here, it is fibrous effusion below the level of the inferior mesenteric artery. And here in this axial CT scan, the patient has a presence of horseshoe kidney with parenchymal isthmus, as we see here, and a large amount of fluid in the left peripheral space. And there is a laceration of the left kidney, left upper moiety in this area. And this is the lower cut level, and we see this is the thick parenchymal isthmus, and this is the aortic bifurcation, and this is the inferior mesenteric artery, and this is the large amount of fluid in the perirenal space. Here, this is the same patient with excretory phase, and 10 minutes after injection of the contrast, and there is injury to the collecting system on the left side, and the right collecting system appears within normal. So this is the end of representing the case of the horseshoe kidney with normal finding, incidental normal finding, and another patient with after renal trauma. A question: what is the relation between the the isthmus and the inferior mesenteric artery. We don't see the horseshoe kidney above the inferior mesenteric artery and the isthmus of the either fibrous or parenchymal above the inferior mesenteric artery. Thank you very much for listening and hoping to see you soon in another talk.